Hi everyone, it's Elise Kleckner. I am doing my flashcard presentation. I hope you enjoy. All right, septic shock flashcard presentation by Elise Kleckner. So the disease process of septic shock, it actually is the last stage of sepsis and not a separate entity of its own. Septic shock is the most dangerous out of any type of shock and is a life-threatening situation that requires immediate life-saving measures if the patient is to survive. There are three stages of sepsis. They are the initial sepsis itself, which happens when the body is overstimulated and overwhelmed in reaction to an invader of the body, such as an infection. The second stage is severe sepsis. This is when the first stage of sepsis is now causing the body's organs to malfunction. This can occur from the blood pressure constantly being too low or body-wide inflammation. And then finally is the most deadly. It's a septic shock. This is when the organs begin to fail due to drastically low blood pressure that IV therapy of fluids is not able to correct. Cleveland Clinic 2022. I just wanted to show you a little picture of what septic shock kind of looks like on the inside of the body, what it affects. Pathophysiology. So the pathophysiology of septic shock is a multi-state and organ process. According to the National Library of Medicine, sepsis is a clinical state that falls along a continuum of pathophysiological states, starting with a systemic inflammatory response syndrome, SIRS, and ending in multi-organ dysfunction syndrome, MODS, before death. Mahapatra and Hefner, 2023, paragraph 9. Continuing on, it begins with early signs of inflammation and can be physically seen in the vital signs and blood work. This may look something similar to what I've presented right here. Fever, temperature higher than 38 Celsius, or temperature less than 36 Celsius, which would then be hypothermia. Tachycardia, pulse greater than 90 beats per minute. Tachypnea, respirations greater than 20 breaths per minute. And leukocytosis, your white blood cells greater than 12,000. Leukopenia, which is low white blood cells, is less than 4,000. Risk factors. The following risk factors are all risks due to one underlying condition. That condition is being immunocompromised. This can happen from a great many of things. Some are cancer, COPD, kidney dysfunction, the infants, babies, the elderly, long hospital stays, being around the very sick, and the spread of those diseases. Invasive procedures, so anything that enters the body that is not supposed to be there, like an IV or catheters. Being on any antibiotic therapy in the past 3 months, and steroid therapies. Mayo Clinic 2023. Symptoms. These also come in stages. The first set is during stage 1 and is when it needs to be caught to prevent progression to septic shock. They include tachycardia, either a very high temperature or very low temperature, having the chills due to temperature, or shaking, being disoriented due to high temperatures, having shortness of breath or hyperventilation, the body is trying to compensate, and sweaty, hot, or clammy skin. Cleveland Clinic 2022. Continuing on with more symptoms. This come after this are when it has transitioned into septic shock and you have little time to correct it. These include the blood pressure bottoming out, extreme lightheadedness from the blood pressure, kidney function decline, little to no urine, irregular heart rate, rash on the skin, and cold or pale in color extremities, all from having no circulation. Cleveland Clinic 2022. Diagnostic tests. To confirm the presence of sepsis, septic shock, the doctor would order blood work to evaluate CBC, oxygen present in the blood, and dysfunction of the organs. They would also want to order chem and lactate and presence of bacteria to see what type is causing it. So antibiotics can or cannot be given, depending on what type it is. Urine sample, spinal tap, saliva sample, and possibly an MRI, CT, or X-ray. Cleveland Clinic 2022. And that is the end of my presentation. Thank you very much for viewing this. Below are my references.